When we think of inflammation, we often imagine greasy fast food, sedentary lifestyles, and unchecked stress, all very real contributors to chronic disease. But what if we told you that inflammation's secret accomplice might be your daily supplement stash? That's right. The same micronutrients we associate with healing, prevention, and vitality can, in the wrong doses or contexts, actually fan the flames of inflammation, especially in vulnerable groups. In short, you might be popping vitamins to live longer and accidentally inviting your immune system to throw a cytokine block party instead. Let's zoom in on some of the key inflammatory biomarkers scientists track when they want to see how fired up your immune system really is. VCM, 1, CRP, and IL-6. These molecules aren't just lab trivia. They're early indicators of things you really don't want, like atherosclerosis, cognitive decline, insulin resistance, and yes, even stroke. And they're not only triggered by cheeseburgers and viral infections, they can also rise when we overload the body with certain health-promoting nutrients. Take VCM1, vascular cell adhesion molecule 1, for example. It's like Velcro for white blood cells. When it's overexpressed on blood vessel walls, it signals immune cells to cling to the endothelium, setting off a chain reaction that can lead to plaque buildup and arterial inflammation. Usually, we see this in conditions like hypertension or diabetes. But guess what else can crank up VCM1? Excessive doses of niacin and other B vitamins, especially when metabolized into byproducts like 4-PY, which act directly on endothelial cells. And if your vessels are already under stress, from age, smoking, or metabolic syndrome, this extra molecular stickiness can accelerate damage instead of preventing it. Then there's C-reactive protein, CRP, the lab darling of inflammation testing. High CRP is linked to heart attacks, depression, cancer risk, and even poor outcomes in viral infections. While CRP is sensitive to overall lifestyle and disease burden, it's also been shown to increase in some populations supplementing with megadoses of antioxidants like vitamin E or beta-carotene.
Why?
Because while antioxidants at normal levels help mop up free radicals, at excessive doses, they can flip the switch and become pro-oxidants, disturbing redox balance and prompting the liver and immune system to respond with, you guessed it, more inflammation. Let's not forget IL-6, interleukin-6, a master regulator in the inflammatory orchestra. IL-6 plays roles in immune signaling, metabolic control, and tissue repair, but it's a double-edged sword. In small, transient doses, it helps the body heal. But when IL-6 is chronically elevated, such as in people taking high-dose synthetic folic acid or certain iron supplements, it shifts the body toward chronic low-grade inflammation, paving the way for fatigue, insulin resistance, and cardiovascular dysfunction. And again, it's not just a bad diet doing this. In some studies, even healthy individuals taking high-dose multivitamins have shown unexpected increases in IL-6, especially if they already had underlying metabolic or immune sensitivities. Now, before we all throw our supplement bottles into the ocean, it's important to say this clearly. Micronutrients are essential. We need them for everything from DNA synthesis to nerve conduction to keeping our mitochondria from staging a rebellion. But context and dose matter, especially as we age or develop chronic conditions. Vulnerable populations such as older adults, people with metabolic syndrome, autoimmune conditions, or impaired kidney function may be more sensitive to the pro-inflammatory effects of excess nutrients, simply because their clearance systems and regulatory pathways are already under strain. A 23-year-old athlete with a perfect diet and a bulletproof liver may tolerate, or at least excrete, an extra 500% of the RDA for B6 without much fuss. But give that same dose to a 72-year-old with reduced liver methylation capacity and vascular stiffness, and you may see a quiet uptick in biomarkers that don't scream, but whisper trouble. Over time, that whisper becomes a warning. What's tricky is that the symptoms of nutrient-induced inflammation aren't dramatic. You don't break out in hives or keel over from one too many gummies. The signs are subtle: increased fatigue, slightly elevated blood pressure, mild brain fog, perhaps even worsened blood markers on a routine checkup. And because these effects are diffuse and cumulative, they're often attributed to aging, stress, or genetics, not the innocent-looking bottle in the kitchen cabinet labeled Men's Ultra Health Boost. So what's the takeaway here? It's not that supplements are bad. It's that more is not better, and blindly layering nutrients, from fortified food, drinks, multivitamins, and standalone pills can create a perfect storm where your immune system thinks it's under attack from your own good intentions. In the end, if you want to keep inflammatory markers like VCM1, CRP, and IL-6 from lighting up like a Christmas tree, your best bet might be less about how many nutrients you're taking and more about how wisely you're using them. Try food first. Use testing to guide supplementation. And if you feel like your supplements are making you weirdly tired, or if your blood work looks worse after starting a new immune booster, maybe it's not your age or the weather. Maybe your biochemistry is just trying to say, please stop trying to help me so hard. After all, even the most well-meaning firefighter can accidentally flood the house.